Hello and welcome to the Bon Secours Richmond Community Education Awareness Series on Neuroscience. I'm Pat Lane, a Neuroscience Coordinator for Bon Secours Richmond. We are pleased to provide this community awareness show on neuroscience and hope that we will spark your interest on neuroscience topics over the next few weeks. At Bon Secours, we provide good help to those in need. If there are any questions you would like answered or more information, please make sure you call our Bon Secours number at 804-359-WELL, which is 9355, or check out our website at www.bonsecours.com. Or you can contact me at patricia_lane@bc.org. Now, all of this information will be posted on your TV screen throughout the show. Stroke unfortunately affects everyone in this country, our neighbors and our loved ones. Every 45 seconds, someone is diagnosed with a stroke. But during this segment, we want to share with you that there are some things we can do to change, so we don't have to be included in this statistic. Tonight, we will focus on a few risk factors for stroke and how we can reduce or change those stroke risk factors for you and your family. We will show you that you do have the power. Our topic for this evening is Good Thinking, Bon Secours, teaching you how to modify your stroke risk factors. So get out a piece of paper, your iPads, or your iPhones and begin to take notes on how to modify your lifestyle and improve your health to decrease your chances of having a stroke. The risk factors for stroke are smoking, hypertension, diabetes, sleep apnea, obesity, lack of exercise, high cholesterol, age, being a male, being African American or Latino. Our guest tonight will shed some light on modifiable risk factors, things you have the power to change and control. Furthermore, we have the expert here on what Bon Secours resources are available to help you take actions towards modifying risk factors for stroke. I am happy to introduce our first panelist, Dr. Gerard Santos. Dr. Santos is the medical director for Bon Secours Sleep Disorder Centers located throughout Richmond area. He received his medical degree from the University of the East and specializes in internal medicine and was voted as one of Richmond Magazine's top docs in 2011. Welcome, Dr. Santos.
Thanks for having me.
Yolonda Thompson is a registered nurse, a graduate of Hampton University and Virginia Commonwealth University Master's Program. Yolonda serves as the Administrative Director of Faith Community Services and Outreach for Bon Secours Richmond. Yolonda, we look forward to hearing from you and the numerous outreach programs that you work with.
Thank you.
Our next guest is Grace Miller. She is a certified diabetes educator, registered dietitian, and works at Bon Secours St. Mary Hospital. Grace received her degrees from Ohio University and is currently pursuing her Master's of Science in Nutrition Education and will complete her degree this spring. Thanks for being with us as well today. And I will serve tonight as your resource on hypertension and will stress to you the importance of knowing your numbers. Callers, we will take your questions between 6:30 and 6:45, and the number to call is 804-915-5202. So, Dr. Santos, I love a good night's sleep. And in the fall, I really treasure it. And I really pity the soul when I don't get one. So could you talk to us about why sleep is so important to be healthy?
Well, I think you just discussed a good reason why to have a good night's sleep, because it makes you feel good, and your body knows what's good for you, and the body knows when it's had a good night's sleep. Mind is clear, reflexes are good, And your memory and concentration is good too, which brings me to what happens when you have a bad night's sleep or when you're sleep deprived. There's a lot of consequences to that. Feeling tired during the day, excessive daytime sleepiness, drowsiness, mood, memory and concentration issues, and poor reaction times.
So how many hours of sleep are really recommended for an adult?
That's probably one of the most common questions I get from the sleep center. It really varies, okay? And I know that's a cop-out, but just as sleep is one of the basic elements of life, and the range on how much sleep someone needs is really individualized. But we can make parameters here. So the newest data from the National Institute of Health is that adults need approximately 7 to 9 hours of sleep on average. Unfortunately, the newest statistics, from surveys say that Americans get on average 6 to 7. So there's been a call to arms to really have this awareness out there that Americans are sleep deprived.
Wow, 7 and 9. I think I'm going to go to bed tonight at 9 o'clock then. I have to get in. So, Dr. Santos, you talked about some statistics, and according to the National Heart and Lung and Blood Institute, some 12 million Americans have sleep apnea.
Right.
Can you really explain what sleep apnea is to our community and why it puts you at risk for stroke?
Certainly. Sleep apnea is it's a sleep breathing disorder that is characterized by repetitive episodes of breathing pauses or breathlessness during sleep. The most common type of sleep apnea is obstructive sleep apnea. And this is when the tissue in the back of the throat actually is narrowed and collapses many times in the middle of the night. So sleep apnea can cause a lot of sleep fragmentation. And again, this leads to symptoms that are related to sleep deprivation, such as excessive daytime drowsiness, mood, memory, and concentration issues, poor reaction times. I think what makes sleep apnea very keen, among all the different sleep disorders, is that it causes oxygen deprivation. Okay, and that's really the pathologic factor that makes this sleep disorder very serious. Is that when you have oxygen deprivation at night, it can lead to other disease processes such as hypertension, diabetes, heart disease, and risk of stroke.
Okay. So that was a nice segue, and I really didn't tell him to do that, but nice segue to Grace with diabetes. And actually in a few weeks, I can't believe it's almost mid-October, but we're a few weeks away from November, which actually kicks off, I believe, Diabetes Education Awareness Month. And we really want to start educating, as nurses, you always want to start early as possible. So what I want you to talk about, and I know it's only an hour show, but I think this is something very important for us to all to get into, is talk to our community on education on diabetes. So what it is, and you hear a lot, it's my sugar, so I really want you to talk about that. And some common signs and symptoms of diabetes.
Okay. Diabetes is basically a condition in which the sugars are high, the blood sugars, or what we more call blood glucose, because the sugar isn't able to move from the bloodstream into the cell as efficiently. So the problem is that when people have high blood sugars, this can increase the risk of a lot of other health issues like stroke. But what I want usually people to know is that diabetes is a controllable condition, meaning that there are many steps that they can make to control their diabetes. Because often people hear about the bad things associated with diabetes. They don't necessarily hear that it's a controllable condition. So as far as what a person would usually feel like, more typical symptoms are going to include increased thirst, increased urination or more frequent urination, sometimes just a general lack of energy. Also, some people will have vision changes or blurry vision. Increased appetite is another signal, and also headaches. So those are typical symptoms that people would have, that if they are having those symptoms, they should definitely be contacting their physician to get evaluated for potential diabetes.
Okay. So in both instances, we've heard that really you need to know your baseline, and when you're different from that, then you need to make sure that you go see a health practitioner. Now, Grace, what tests are done and what numbers should we indicate that you're diabetic or pre-diabetic that we want to look at?
Okay. The doctor can do multiple tests to diagnose somebody with diabetes, but more frequently physicians tend to use either a fasting blood glucose test, or they may do a hemoglobin A1C test. Fasting blood glucose test in somebody non-diabetic should be below 100. In somebody pre-diabetic, it's generally between 100 and 125. In somebody with type 2 diabetes, above 126. The A1C test is an interesting test because what it is monitoring or evaluating is a person's blood sugar control over the previous 2 to 3 months. A non-diabetic would have an A1C below 5.7%. A pre-diabetic, somewhere between 5.7 and 6.4, and a type 2 diabetic above 6.5%. And all of those percentages do correspond with what is considered an estimated average glucose.
Okay. So callers, I know we gave you numbers, and if you need us to repeat them, certainly we can do that if you call in. And I know on our website there's some areas, and we'll talk about some other resources where you can get those numbers more frequently. Now this weekend, although November is Diabetes Awareness Month, I think there's a walk this weekend as well.
Yes, right? This is the American Diabetes Association Walk, which is a yearly walk that not only supports individuals with type 2 diabetes, it also supports individuals with type 1 diabetes. This year it's going to start at the Bon Secours St. Mary's Hospital, Monument Avenue. The walk is usually about 2 miles or so, but you can go at your own pace, and it's just a really good time to meet other people who have diabetes, who are supporting diabetes, so it's a fun activity for really the whole family to go to.
Okay. Hey, Yolanda, Bon Secours' mission is really good help to those in need, and you have certainly been a servant for Bon Secours for over 20 years. I said it's all of us together, so you're really the leader for Bon Secours here. Can you discuss your role with Bon Secours and how you work in the community to educate and work with the ministries and faith-based?
Yes. Pat, I know you mentioned Bon Secours. It's the French term, or the French meaning for Bon Secours is good help. And we really, really thrive here at Bon Secours on good help to those individuals. And we're talking whole person. We're not just talking about health, but we're talking about the safety, the security, the living environment, school or education, recreation, the whole person. So our initiatives are really focused around that. And my work at Bon Secours primarily is doing health and wellness initiatives in the community. For faith community services, we focus on the faith community. However, when we're doing programs with and for the faith community, we do also reach out to all persons, and we see it from the cradle to the grave. All ages. It could be from a preventive perspective, it could be on a maintenance perspective, or just an overall awareness, so people will become more in tune with themselves before problems occur, that they can take charge of their health. We have so many initiatives going on in the community, and I'd like to share them if this is okay.
Absolutely, absolutely.
Okay. When we talk about stroke, we have our cardiac, Heart and Vascular Institute. So with our Heart and Vascular Institute, there are a number of initiatives where an assessment can be made to see what your blood pressure is, to see if you're at risk for a cardiovascular or a vascular event. So, there are assessments that you can find on our website. You mentioned our website earlier, that people can go and check up for health screenings. There's ongoing health and education programs that are done throughout our Bon Secours service area. We have programs like the JOY program in the churches. The JOY program is a cardiovascular risk reduction program whereby there's a 20-week comprehensive nutrition and fitness effort. Persons come together for 20 weeks and they learn on a topic per night so that it helps them to really take on this information slowly, gradually, and start making changes. Then the other half of the session, that evening or night, or it might be a Saturday morning, is that they get up and move. So there's a fitness part. Of course, that is an expectation that you do throughout the week, but at least together there's a fitness activity. So what we've seen with this program we've had here in the Richmond area is that when it was initially done by Johns Hopkins, there was an 18% risk reduction for your behavioral and your biometric measurements that you do at the outset. In the Richmond area, we've seen that or better when persons are in this program. So we're excited about the JOY program and want to continue to have that as an option for persons in the community. Another program that's geared towards the children is Moving Mania. It's relatively new. Bon Secours launched this recently, and it's an interactive program for children up to the age of 14 that's done online. And so the children learn to eat healthy, to move more, and then to stay that way so that they are sustained over time. And it can prevent such conditions like stroke.
Wow. See, that's what we want to know, and I'm sure the community wants to know how they can get involved with you. So we'll come back to how they can definitely contact you and know a little bit more about the mission. I want to talk a little bit about hypertension or high blood pressure. And hypertension sometimes is called the silent killer. And we want to explain this a little bit because high blood pressure it does not have any symptoms. So you may not be aware that it's damaging your arteries, heart, and organs such as kidneys. Blood pressure, what that means, it is truly the force of the blood against the walls of the arteries and includes two measurements. And we're trying to tell you this because when you go out now and go to these programs and you get your blood pressure, you really want to know, as we talked about, baseline and what things are doing. So when you get your blood pressure taken, there are two numbers. The top number, we call that the systolic pressure. This represents the pressure as the heart beats and forces blood into the arteries. The bottom number is called the diastolic pressure, and that represents the pressure is actually the heart relaxes between beats. So I talked about in the beginning knowing your numbers, and I want to definitely go over those with you today. So if you were, we heard from Grace about being pre-diabetic. For normal blood pressure, it is anything less than your systolic 120 or your diastolic 80. For pre-hypertension, we're talking 120 to 139 for your top number and 80 to 89 for your lower number. High blood pressure is 140 to 159 or 90 to 99 is your lower number, and that's your stage 1 of your hypertension. And stage 2 for hypertension will be 160 or higher for your top number, and your diastolic number would be 100. And then what we call a hypertensive crisis is anything higher than 180 or your bottom number greater than higher than 110. Now, Yolanda, I do know that one of the resources that you have shared with me, and we're very happy in working with them, is the High Blood Pressure Center here in Richmond, and they're celebrating their 30th anniversary. Can you talk to me how that relationship formed and how you tell people how you passed it on to me so that I could be able to use it, which is great.
Well, many years ago, there was an opportunity to work together with the underserved and the uninsured populations. And so from that, I can't even tell you how many years ago it was that we began the relationship with the Richmond High Blood Pressure Center. And we're pleased that we continue to have a relationship and collaborative efforts with them. There's criteria, you can call the center or go online and look at the criteria that, one must meet in order to be served by them. But they continue to reach out and serve many, many Richmonders, and we're so pleased to have such a service in the Richmond area.
And this callers, the Hypertension Center actually is in the city of Richmond, 1200 West Carey Street. And I want to say it does complement Grace as well. The eligibility that Yolonda was talking about, your blood pressure has to be 120/80, as we talked about, that's hypertension. Your blood sugar has to be over 100. You also, this is great for people who do not have any type of private health insurance and it's based on income, or be employed by a small company that can't afford to have health insurance. So again, we're there to help you with resources so that you can be able to do that. We also are very happy that we are having Bon Secours Neuroscience Institute was just awarded a grant with the American Heart Association, and we're going to be using the Hypertension Center to partner. So that's a big plus, and we're going to kick off that in January. Another big risk for hypertension we talked about and affects sleep is smoking. So I'm sure all of us could go in our bandwagon with that and how it affects all of us. But I'm going to start with you, Dr. Santos. Can you elaborate really on how smoking affects the airway and contribute to, or does it contribute to sleep apnea? It
does. And sleep apnea is, obstructive sleep apnea is when the upper airway is narrow. And there's some studies that show that smoking does, narrow the upper airway because of increased inflammation and so forth. So we do see those patients that are pack-year smokers come in, and then, a few years after, they start smoking, they have symptoms that are related to obstructive sleep apnea. So yes, there is a clinical correlation there.
Okay. Now, with sleep apnea, how does one know, because they're asleep, that you have that? Are there tests that you can do to determine if somebody really has obstructive sleep apnea?
So the best assessment is a clinical assessment, first and foremost. And just like most disease processes, a clinical assessment is always first to start off with. And you're right, in most of our patients, they don't know what they're doing with their sleep. So a lot of times too, we ask the bed partner, spouse and family members to help us with our assessments. And so sleep apnea patients typically have cardinal signs and symptoms. They're tired all the time, despite how many hours that they sleep. The common symptoms that I hear is, Doc, it doesn't matter how many hours I sleep, I'm still tired. And so it's a sense of poor sleep quality, despite normal hours of sleep. They're known by family members and friends to be loud snorers. And the snoring is really testimony to a narrow airway that is easy to collapse in the middle of the night. And we've also, discussed other comorbid conditions, diabetes, hypertension. Hypertension actually is a very, very strong disease process that is associated with obstructive sleep apnea.
All right, so what can you do for somebody besides hitting them in the elbow and stop snoring and get up and go in the other room?
So I think that individuals who have a constellation of these signs and symptoms, should first ask their primary care provider if they are in need of a sleep assessment. The best sleep assessment is a polysomnogram. It's an overnight test where a trained sleep technologist actually monitors your sleep and looks for these breathing pauses, quantifies it, and has an objective report that gives us an idea about not only if someone has sleep apnea, but the severity of this sleep disorder.
Okay. And does somebody have to get a referral from their primary physician to get that done, or how is that done?
Typically, in certain insurances, I think that they do need the primary care doctor to generate that request. but I do see patients that have self-referred themselves.
Okay. All right. And then what treatment approaches can be done once I say I have a positive test? I know I have sleep apnea. What can be done?
Well, treatment revolves around keeping the airway patent, making sure that those tissues in the back of the throat doesn't collapse, which is easier said than done. But the gold standard treatment for obstructive sleep apnea is the use of an air pressure generating device called a CPAP device. And what the CPAP device does, it provides air pressure that supports the back of the throat, the tissue in the back of the throat, with breath by breath, and prevents it from collapsing, thereby restoring normal breathing during sleep.
Okay. Are there any diets or exercise that can help with this as well?
Yes, absolutely. Weight management is a very successful treatment for sleep apnea. And what we've found out in our population of patients is that typically a reduction of about 20 to 30% weight reduction can decrease the severity of sleep apnea by half.
Wow. Okay. So I think we're going to hear that theme around too, is doing exercise and weight loss and diet. Yolonda is a parish nurse. If I was interested in teaching my faith-based community maybe the importance of not smoking, how could I contact you and how could you assist me with getting that program going?
Yes, you can contact me by calling one of our facilities.
Okay.
And I know you're going to have the number out there on the screen. We do have opportunities. I can just share one of the opportunities out in the community is there's someone that's ready, and it's 1-800-QUIT. You can dial that number, 1-800-QUIT. It's one look, and the theme came out, one more little reason to quit, and that was around infant mortality. So there's some services out there. Smoking cessation, Bon Secours has been involved internally with smoking cessation, as well as being able to go out in the community and teach that. We actually have partnered up with an organization recently at the state fairgrounds during a race, race car weekend, and we're out there teaching smoking cessation, or at least informing people, making people more aware, what it's doing to their bodies, how much it's costing them, so it can at least create an awareness to start thinking about, am I ready to quit?
And I know Bon Secours was one of the first workplaces to say that you couldn't smoke at the workplace. And so they've really been saying, we really need to be role models and do that wellness. So Grace, you told us earlier about the numbers we're looking for to indicate diabetes, fasting glucose of 100 or greater. Can you discuss to the community, because you said these are things that we can change, and we heard already 20 to 30 pounds for sleep apnea. Can you talk a little bit about diet and exchanges and what happens when I should walk into the grocery store if I'm pre-diabetic or diabetic? Should I turn to the left, right, or what should I do?
Okay. One important point before I go into that is somewhat like you mentioned about hypertension. Sometimes people don't know the signs. They might not feel bad, and if they don't feel bad, sometimes they don't go to their doctor. So sometimes what you do want to know are your risk factors, and risk factors for diabetes being over the age of 45, being overweight, having a close family relative who has diabetes, being of a certain ethnic group like African American, Hispanic American, Asian American. So anybody who has those risk factors should really be going to their physician to potentially get evaluated for something like diabetes or any of the other health conditions. And that way they are screened and they don't wait until it's too late. So as far as what we want people to do, when they're going to the grocery store, first of all, label reading is key. Making sure that you are picking up, not only just purchasing things, but also looking at the label before you purchase. And to know what to purchase, that also means knowing what those numbers mean that are on the label, and there are a lot of numbers to know. And that's something that someone like me, a certified diabetes educator, or a registered dietitian can definitely help a person with. The other thing that people want to be aware of is the foods that are on their plate, obviously. And most people at one time or another have used those Dixie plates, the portion controlled, I guess, sectional plates. Mm-hmm. And when I ask people, what food would you usually put in the big section? Many people tell me the meat, or they tell me I put my potatoes there. That's where really I want the vegetables to go. Okay, so without really getting into a lot of the numbers, if people just picture that plate with a bigger portion being vegetables as opposed to the meat or the starchier food like the mashed potatoes or the macaroni and cheese, that would be one good thing that everybody could really do.
Okay, great. And I'm glad you said about reading labels. I'm going to talk a little bit. And callers, it's time for you can call in now to our number if you have any questions. We'll be glad to answer them. But reading labels is definitely very important for hypertension. And one of the things that we always talk about with hypertension, and there's one contributor, just like we look at sugars, and we'll come back and talk about carbs a little bit, but salt. Salt is really something that we say that we would like to stay away from if you're hypertensive. And that's because salt does raise high blood pressure, because salt actually keeps excess fluid in the body, and then that can put burden on your heart or your kidneys. And so we tell people to really cut down on the salt. And I'm going to give you some statistics so you know example of your numbers. Like I said, today I want you to know your numbers. So the Health and Human Services and U.S. Department of Agriculture have really published guidelines that say that if you are not hypertensive, you can have 2,300 milligrams of sodium a day. And those with high blood pressure should have only 1,500 milligrams. Now you can have it, but you don't have to have it if it's doing okay with that. And there are a lot of resources we're going to talk about to assist the community. We talked about Bon Secours. You can certainly go to our website. We have some things up here on the table, the American Heart Association. And recently, through our community partnerships, we met a layperson, Helen Woodward, in the community, and she has actually written this excellent guide, and it's called Salt is a 4-letter word, and have a higher consciousness to lower your blood pressure. And I thought this was a really nice thing. The thing about this book is this is one that you could take to the grocery store, and it actually has labels on here of certain things, of how much the serving size is, because that will fool you. You think you can have a whole can of something and look and say, oh, that's 4 sizes in that one can. So you want to make sure that you're looking at that. This weekend, actually, the diabetes walk will be on one side, and then on the south side, we will be having something at Watkins Center. We're opening up our Neurodiagnostic Center. And so this weekend, we will be focusing on stroke and nutrition. And so I know I will be there, and some dietitians will be there as well to talk about some of the things that you can do. And I believe Helen will be joining me as well for us to talk about real life things that you can do, portion size, making it as a family affair of what you can do around. So we're very pleased that we'll be able to offer some of those. I was glad you said about Moving Mania. That's First Lady Obama's initiative on eliminating childhood obesity, which is something else we talked about as a risk factor for all of us that are here around the table. So I'm going to ask Dr. Santos now with sleep. What else? Are there any things that I can do after I've had my test ergonomically with my bed? Uh-oh. Hold on. Hi, caller. How can I help you?
Good evening. You talked about a number of milligrams of salt. I wonder if you could tell me how many teaspoons that would be.
Oh, I wish. Okay. Yolanda, Miss C Community Resource, that's why we're here. Yolanda will tell you. You might have to hang up, caller, to hear it, I think.
Okay, thank you.
Uh-huh.
Yes, the 2,300 milligrams of salt that we are, that's recommended that we have maximum a day is about 1 teaspoon. And what we're finding is on average, individuals are taking in or consuming about 3 teaspoons a day. But we want to really get that down to about 1 teaspoon if you need to have something to picture to have those 2,300 milligrams or less.
Great question, caller. Thank you. So Dr. Santos,
Yes.
we'll go back until we get another call.
Okay.
Ergonomics,
ergonomics.
or anything you can do to, since you said it's
Yes.
obstructive, is there anything that, should I sit up in a chair or prop myself up? Or?
Yeah, typically obstructive events, sleep apnea is worse when you're on your back. And that's really what happens there, is that the base of the tongue slips back and stops up the windpipe. So when you're on your side, that mechanism doesn't happen as often. So that's what we advise on certain patients that have a mild case of sleep apnea that typically happens really when they're on their back, is we ask them to sleep on their side with the use of bed pillows, bed wedges, and it's pretty effective.
Okay. Is there any, and I have to ask for the callers, is there any type of surgery that can be done for obstructive? Or?
Yes, and surgery involves removing those tissues that are prone to cause narrowing or collapsing of the upper airway. Actually, some surgical techniques have been shown to be very successful, particularly with our pediatric patients. And so kids fare better with having surgery for their sleep apnea.
Okay. All right. And Grace, are there any other pearls that you want to say? We talked about some of the foods. Can you talk about, you talked about your plate and the size portion, which we all think is good. But, and can you talk about what else should be on your plate? I read or saw somewhere that there should be some different colors on your plate to help you out. So if you could just talk about that a little bit more.
Well, basically, the more colors your plate has, the more nutrients or more variety of nutrients that plate is going to have. So if you look at your plate and all you see is white and brown, that usually means you got starch and meat, and you're really only getting the nutrients from those foods. But if you get throw in some carrots, you're getting some vitamin A. If you have an orange, now you get some vitamin C. If you have some green vegetables like broccoli or Brussels sprouts or asparagus, now you get some of the vitamins in those as well. So having the variety of foods on the plate of different colors really ensures that you're getting a well-balanced, a well-rounded diet.
Okay. All right. Yolonda, can you talk about some more of your programs that you, I know with particularly the, I think you meet with the parish nurses and you have a newsletter if somebody wanted to read that?
Yes, our network has been around now for 14 years. And with that, we have trained nearly 200 registered nurses to do health ministry successfully in the congregation. We also have a lay health ministry course that we prepare persons who might be an LPN or may not have a medical background at all, but have an interest in leading the effort within their congregation. So we provide those preparation courses, and then we go into and help them do health ministry successfully in their congregation. And it's, it's gone well. A lot of high blood pressure has been identified, referred out to their physicians. We actually do a blood pressure measurement specialist course. And we train RNs who've been doing blood pressures all along, maybe in their work setting, but not in a congregation independently. So we want to make sure the equipment is correct and accurate, the size is right, the person is in the correct position, because all of this will impact what the blood pressure reading is. And then that they're current on when to refer, what recommendations to give, that they're going by the current national standard guidelines. So we're excited about that's the most common within the ministries of the congregations we work with. Then there, cancer focus, there stroke initiatives, there are the walks, we get together with the walks. There's a walk to Jerusalem that some of the churches just did. whereby you count the number of miles from Richmond or from your congregation to Jerusalem, and it's all in an effort not to have much strenuous exercise, but we're walking. And it's free, it's not strenuous, most of us can do it, and we're counting our steps and adding them up to the miles, 5,990 miles to Jerusalem, and when you get there, there's a celebration. You can walk to Bethlehem. So those are some of the, small, and we also have comprehensive programs that we work with or help the health minister to be successful in the congregation, so that the outcomes are what we really want to see improve. We want to improve the health of that faith community so that person can serve and do what they're called to do. I will just want to highlight another initiative for Bon Secours, and that's our mobile outreach services, our caravans. They're out there, they've been in the community also a number of years and seeing higher and higher numbers. They moved from a model of being out there, all these health screenings and immunizations to whereby now it's a medical model that's serving the uninsured. And so we're really out there helping, to meet the needs in the community where people are.
Great. There's one other element that, although it is not per se something that is on here as a risk factor for stroke, I always feel I'd be remiss if I don't talk about it, and that's stress and the mental component. And I'm sure all of us could say something about that as well, but it's very important for us to know, again, what is your baseline, and think of positive thoughts, and to make sure, if you laugh a certain amount, it does bring down your blood pressure. I've seen some practitioners say, think of the most funniest thing, and then I'm going to come back and take your blood pressure, and it does tend to ease because of the white coat syndrome also helps to elevate. So I don't know if you want to talk about that. We'll start with you, Grace, on this side about stress and how it may affect your diabetes or the patterns that you might have.
Stress can raise blood sugar, so it is important for people with diabetes to manage their stress, which it can almost be easier said than done for some people, but the thing that I worry about with regards to stress is how people are managing their stress, especially if they're managing stress with food, because that is just going to lead to the obesity and the overweight condition, which is going to further increase their blood sugars and their other risk factors. So I encourage my patients to find non-food coping mechanisms for dealing with stress. Some you mentioned, but others it could be for those who are interested in more faith-based to read verses of their Bible, to write a poem, to do a journal, to just get out of wherever they are, even if it's for a few minutes, and just take some deep breathing. Because sometimes people just need to get away, even if it's just for a few minutes out of their day. So I really try to encourage people do some type of stress relief on a daily basis, not just when they get stressed.
Okay. And I know, Yolanda, there are numerous programs with stress. If you want to talk about some of your co-workers, I know who leads some of those programs.
Our employee wellness has a plethora, if you will, opportunities for education for employees to come in for health and to reduce stress. There are also some offerings in the community, and it's done by various departments. So we ask that we try to get the word out, various marketing mediums to let them know when there's a program going on. Even in the programs that I actually present myself, just like you just said, there are just some things that you can do. The meditation, the quiet time, the deep breaths, taking the deep breaths in slowly, taking them in and holding, and then slowly letting them out, Hold
on for 1 minute. Okay. Yes, caller.
Yes, about blood sugar. Does blood sugar glucose level fluctuate during the day? How do you know whether you're under 100 or over 120? Is it a good idea to have a meter to take your blood glucose level? And also, could you talk a little bit about artificial sweeteners?
Oh, that's a good one. Thank you.
Thank you.
I encourage most of my patients to monitor their blood sugar, because monitoring your blood sugar is really the only way you can evaluate if what you're doing at home through your daily life is working. Otherwise, you're waiting to see your physician for another 3 months, another 6 months, and there's really no gauge to know what your blood sugars are. So I do encourage monitoring for most of my patients, and that number of times can differ depending on what that person's, I guess, how high their blood sugars are or how normal their blood sugars are. So definitely encourage. Now, with regards to artificial sweeteners, the Food and Drug Administration states that all artificial sweeteners are safe for the general population. There are some experts who tend to believe that artificial sweeteners like Splenda, which uses the sucralose, or the herbal sugar substitutes like Truvia or Sweet Leaf are generally the better options for patients. So patients really do have a wide variety that they can choose from, and any of those would be good to choose, really. Or if people are weary of choosing those, they could simply drink beverages without the sugar, which could be something as simple as water, but if you want to add some flavor to it, squeeze a little bit of lemon or lime, getting a little bit of club soda and maybe putting a little bit of fruit in it. Really try and steer people away, though, of sugary beverages. That not only includes soda, but that also includes juice, because a 12-ounce amount of juice has as much as 15 teaspoons of sugar, and 12 ounces of soda can have as much as 10. So juice actually has more sugar per teaspoon than soda does. And most people don't necessarily think of juice as having that amount, but it is very high. So preferably more of these unsweetened beverages for most people.
Okay. And I'm going to talk about taking your blood pressure at different times of the day as well. I think the one thing is that you want to make sure that you know your baseline at different times of the day, because you will see what it fluctuates. And we usually don't, as healthcare practitioners, we'll look at one, but we won't recommend something right away unless there is a trend or a pattern. So we want to make sure we do that. The other thing that I said I want to remember when I talked about salt is one of the things that I would love for callers to stay away from really are canned foods. And it may be some of the same things with diabetes. When you look at the canned foods, anything that can be on your shelf for over 6 or 7 years is typically not something that you really want to eat. And look at those preservatives that are really in there.
And sorry, one thing I'd like to bring up actually about that, it's not really the salt that you see, it's often the salt that you don't see. So if we take a typical restaurant meal, can have way over that 1,500 milligrams. A typical sandwich at a restaurant can already have 1,000. And if we're talking about limiting sodium to 1,500 a day, you've already reached your sodium by lunchtime, even breakfast possibly. So a lot of people tell me I don't use table salt, which is great, but it's really those processed foods, especially foods at restaurants, that have the hidden salt that people need to look at.
And the special sauces and gravies and things like that. I can't believe we only have like 10 minutes left. So I'm going to go around and start with you, Dr. Santos. Anything that you would like our callers to really know, and tie it in again with the signs and symptoms of a stroke. We haven't talked at all about where your center is or hours of operation, so feel free at this time.
Well, I think that a stroke and sleep apnea are in the limelight now in our subspecialty. And the newest data that we see is that stroke victims, in certain studies, 3 out of 4 stroke victims have sleep apnea. And although it is an association, we can understand the reasons for that, because what happens in a stroke basically is that you have a lot of this fight and flight response. The blood pressure is up, the heart rate is up, and you have a lot of adrenaline surge that causes the stroke. Same thing that happens in sleep apnea. You know, the oxygen level goes down, you're not breathing very well, and the same kind of pathologic factors that go into sleep apnea are also similar to what happens in the stroke. And that's the relationship that we're seeing between stroke and obstructive sleep apnea.
So how can we get in contact with you?
Well, we have 3 centers. We're on the 7th floor of St. Mary's. We're also in Memorial Regional Medical Center, as well as in the Chesterfield area, close to St. Francis Family Practice.
Okay. All right. Yolanda, you have some things that you want to close with?
Well, I just want to say that within Bon Secours, there are a number of departments and individuals that our ministry is outreach. So there are so many initiatives going on. If you contact us, we can probably be more specific and give you direction according to that. We also have so many partnerships and alliances in the community. In the East End, there's the 7th District Health and Wellness Initiative that's led by Councilwoman Newbill. And that, you know, the whole goal is to ensure that the residents of the East End are their healthiest and that they have a medical home. So we have a tremendous partnership with that 7th District East End Initiative, or Health and Wellness Initiative in the East End. We have a huge partnership with the Richmond Promise Neighborhood. With Richmond Promise Neighborhood, it is an initiative in a geographic area in the East End that the overall purpose for it is to support our children to reach their potential. And to reach their potential, we're talking about from the cradle to career. So there's focus on academics, there's a focus on safety and security in the neighborhood, at school, at home. And of course, my part in that is the health part. I serve as the health liaison for the Richmond Promise neighborhood. And, you know, we're moving forward, we're working with children, you know, in the East End. Of course, now's the time to educate on such things of health and nutrition and physical activity, because they're the ones that's going to be growing and thriving so that they can reach their potential, you know, to career and beyond without developing such conditions. We also have other partnerships like the C.D.E program. It's an entrepreneurship. I got it out there. Initiative whereby we're helping companies and businesses to start up, you know, and be successful. And so again, it's not just about health, but it's about employment, it's about education, it's about recreation, and so forth.
So that's truly Maslow's hierarchy of needs, being able to cover the entire spectrum and the family portion and everybody taking care of one. So thank you for that. And Grace, do you have anything that you'd like to?
Sure. Bon Secours Diabetes Treatment Center has been pretty successful with helping patients meet their blood glucose targets. One of the reasons we're able to do that is because most of our staff is certified diabetes educators, so we have registered dietitians and registered nurses that not only help people understand their condition, but also help them manage their conditions so they know what things they need to do on a day-to-day basis. We do have a center at St. Mary's Hospital, but also at Memorial Regional Medical Center, and then near the St. Francis Hospital as well, and also Richmond Community Hospital. So we have 4 centers. And there are also multiple programs available for the uninsured and underinsured at Bon Secours that I encourage people to contact Bon Secours about, because they can, if they're interested in one of our services and don't have insurance, that's something that Bon Secours can help with.
Great. And I was going to say again, if you want to talk about the walk, that I'm sure there'll be a lot of resources out there at the walk on this Saturday.
I highly encourage people to go to the walk. It is a fun day. We usually have good weather for this walk. So it's just a great thing for people to get involved in, even if you don't have diabetes, just to get out there and do something. A lot about managing health conditions is just moving, getting up and moving. And a lot of times people say, well, I don't want to do it alone. Well, you don't have to do it alone. There's a lot of walks in our area, not just for diabetes, but like you mentioned, the walk for stroke, that people can just get out and move with other individuals and get that support.
Yeah, Saturday is going to be a beautiful day, so I would encourage everybody to come out. And then the next Saturday, so the 13th is the diabetes walk, and then the next Saturday is the heart walk. And actually, even though I believe it's in Innsbruck, there are several different places that people will be having their walk. I know the 7th District has set up their walking path, and that's something that some churches have set up just in support of that. And I'll say for both initiatives, the funds that go to that are continually looking at research and being able to help to look at ways we can cure and help people to modify that. I'll stop on the American Heart Association again one more time. They have some wonderful tools on their website. And one of my favorites really is joining the movement and shaping your family history. So this is a nice fun activity that you can do, and it is on the website. And you really trace your family tree, and it's something that you can do with your family members, and you can do it at your family reunion or sitting out at the picnic, of exactly what is your health history, and knowing that while some of these genetic disorders or diabetes or stroke or hypertension may have come to you, you can be the power to be able to change that and not to have that move on. So I do want to put out a plug again to look at the resources. There are so many things and so many helpful tidbits that you can be able to get for that. Next week, this was our first segment on stroke. Next week we will have talking about stroke treatments, because things have really changed from long ago when you first had a stroke. Now within the first 3 hours, depending on the type of stroke that you have, you may be able to be treated. So we're going to be talking next week with a couple of physicians. One is the ED medical director, and he's going to talk about the importance of knowing to call 911. You've heard about the risk factors here today, and if you have those, to have a heightened awareness. So if something just doesn't feel right, then you need to know to go to where to get help. The second physician will be a neurologist, and so he may pick up on some of the sleep apnea and diabetes that we talked about today, and knowing what exactly will happen when you come into the hospital, so you know how we can care for you, and talk about a clot buster TPA that you may be able to receive. And the third physician is going to be an interventional specialist, and we'll talk about if you come beyond that 3 hours, depending again on what type of stroke you have, that they may be able to help you out until 3 hours. The important factor is that you know what time you are last well, and we need to know some of your baseline, like medications, what's going on, who was with you, so that we can be able to prevent. So I'm hoping, callers, this was a very good show, a lot of nice questions, that you have received some information today on hypertension, that you remember your numbers of knowing what anything 120 over 80 and higher is getting you towards hypertension, and so you need to look at that. That when you look at diabetes, it's at 100 or more when you're looking at fasting glucose. That if you snore, or you ask your partner if you snore, that you need to know that you may need to do something as well. And certainly that Bon Secours has a wealth of resources, as Yolanda says, from the cradle to the grave, to be able to help you in a lifestyle. Thank you very much, and I'll see you next week.